Hey Lala, thanks for the question. I can definitely relate to how you feel because I wanted to know everything about every single medication, how it worked, why it worked, and that definitely can be overwhelming because there's so many medications and so many drug classes and inhibitors and agonists and all kinds of things. At the core, I just want you to know I'm going to share my best resources that I used, but also medications are a small piece of what we do. So, my first and best recommendation to understand how neurotransmitters work is this book by Stephen Stahl, Dr. Stephen Stahl, his Essential Psychopharmacology book, not the prescriber guide. This is how medications work, all the mechanism of action. So it really starts at the core, like the 5 ways that medications can be transported and can change gene expression and just how they work. So breaking it down from there, and then you can imagine how the list goes on. Also, any book that I talk about will be in my link tree so you can find it and get it for yourself. But this is my number one resource. It's going to go through every single mechanism of action in detail with pictures and in great detail, explaining specifically what is going on. The next piece that I would pair with any book is to write it down. I have notebooks and notebooks of different explanations for all kinds of things, where dopamine is made, how it's made, like things like that. So you can have all this information and it's really difficult to organize it and synthesize it. So what I recommend is to read something, make it a topic, and then put it in your own words to synthesize it, and then you can retain it. And that seems to work very well for all the people that have implemented this routine. Number two in my list of recommendations is the Maudsley Guidelines. And these are UK guidelines. However, they are so well done and current that they have been translated into other languages for other countries like Spanish. It's in Japanese and in Chinese as well. So this book is definitely another one that explains how each medication works, the side effects, the receptors that it binds to, and really breaks down all of the how and why in a different kind of version. It has 16 chapters that are very specific with more so the overall condition and then the treatments that we use for that condition versus the first book that I mentioned is just mostly how everything works. Book number three, The Handbook of Essential Psychopharmacology by Dr. Ronald Pice. This book is another wonderful breakdown in a different way than the previous two. Those were more guidelines and facts. This is kind of a piece where they bring studies and numbers with facts and combinations and common questions. So for each chapter, there's a section of common questions that we all have that are explained in just straightforward and no extra fluff. So I really have learned so much from this book. And you can see if it's tabbed, that means I'm still reading it. The fourth book that I would recommend is Successful Psychopharmacology by Stefan Sabel. And he is a psychiatrist and professor at the University of San Diego, UC. And this book gives so many gems and pearls and combinations. This is one of the books that really nailed down how escitalopram is a newer version of citalopram, but it explained how the R and S alleles and the affinity and why Lexapro has more affinity via the bilat S alleles. So those kinds of explanations are what I like. What happens when you withdraw from your SSRIs? How do you treat it? All the things. What is going on with nightmares and vivid dreams when you start or stop a medication? So just very methodical pearls that are very common, and this book is very helpful. This book just has so many pearls: how to treat and manage sexual side effects of antidepressants and medications. It really has a lot of information that is useful to your question. And this book was published in 2012, but I think it's still relatively up to date with the overall topics that come across my clinic. Please remember, you don't have to know everything when you graduate. You will learn, you will continue to learn. All these books are tabbed for a reason. I continue to open them and refresh my memory. As always, thank you for watching, and I'll see you on the next one.